Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College. And today's show is a little different than usual, as we learn about our local hospital systems and their efforts to prevent serious injuries involving gun violence. My guest today is Dr. Jose Prince, one of the leaders of the Northwell Health Center for Gun Violence Protection. Dr. Prince is the Vice Chair of Surgery, as well as the Vice President and System Chief of Pediatric Surgery and Acute Care Surgery at Northwell. He is also Surgeon-in-Chief at Cohen Children's Medical Center and a Professor of Surgery and Pediatrics at the Zucker School of Medicine at Hofstra-Northwell. Dr. Prince, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you so much, Dr. Jeanine.
Tell us a little bit about yourself. What made you want to become a surgeon?
Yeah, it's a great question. I grew up in Queens. I was born and raised in New York. My parents are both Cuban exiles that came in the 60s to the United States and landed in New York, unlike most of my extended Cuban family that ended up in South Florida. And I had a grandfather who was a pediatrician in Cuba and who loved being a pediatrician. I didn't grow up around him, but I grew up on the stories of who he was and what it meant to be him. And I constantly had folks coming up and saying hello and telling us about how my grandfather had made a change in their life when they were little kids or in their family. So I grew up with that in mind. And then as I grew up here on Long Island, went to Chaminade High School and really loved the science and the math and everything that was pointing me towards a career in medicine. So between that family story and my love of science, I found my way to college at Georgetown down in Washington, D.C. And while I was there, I had the tremendous privilege of, as an undergrad at Georgetown, to go to the National Institutes of Health to do research in the summers. That was my summer job to pay for a little bit of school. And that opened up such a wonderful world of science and of the physicians and the high quality of work that's done there, which ultimately directed me to medical school. And in medical school, I just loved the idea of being a doctor. I didn't really have a defined area. I guess I thought maybe I'd be a pediatrician based on grandpa and then abuelo, as I called him. And then when I was going through the wards, I fell in love with surgery and just the ability to change a life so dramatically and so effectively, it seemed to me so often. And really from there, I eventually went to the University of Pittsburgh to train as a pediatric surgeon and as a surgeon over 10 years. And while I was there, I reunited that sense about being a pediatrician to my training as a surgeon to become a pediatric surgeon.
What a wonderful story. How prevalent are gun-related injuries here on Long Island?
It's a devastating problem that has seen a real spike since, especially in this last year and a half with the COVID pandemic and so much of the unrest. We especially are seeing increases out east in Suffolk County, but really there's no area that's immune. It doesn't actually depend in some ways on what community you live in, and in other ways it very much depends on which community you live in. And I think about gun violence in four big categories. One is self-inflicted, and it has to be said that the highest volume of gun violence is self-inflicted suicide, and that happens really in every community across the spectrum, and sometimes doesn't get the same attention because of all the stigma that comes along with suicide and those kinds of conversations and the troubles that folks face. Then you have the kind that gets a lot of attention on the other spectrum, which is the mass shootings and the active shooter events, which are really a tiny fraction of the gun violence, but get so much of the attention. And obviously, very recently in Hempstead, we had over the last year an event where there was an active shooter concern at a supermarket. And, the schools went into lockdown in the area, including my sons who now go to Chaminade High School, for example. Those are the two bookends in terms of volume. But then it has to also be said the purposeful violence that we see in terms of crime and folks who are assaulted with gun violence as another group. And then the final group, which really breaks my heart, especially as a pediatric surgeon, as it often involves children, is unintentional injuries. A child often who finds a weapon that is not secured appropriately and who discharges the weapon and injures themselves or someone else.
So are you seeing a rise in gun violence since the global pandemic?
Yeah, we have. We've seen that here locally in New York, and we've seen that across the country. And again, you see it in all of those categories, not just in any one category. And it's really been a sad corollary to seeing the rising deaths that we've all experienced as a result of the COVID infection itself. Really, we've had this pandemic or we've allowed it to become an endemic problem in our society. This isn't new. We see 40,000 injuries a year across the United States, 40,000 deaths across the United States, and over 70,000 Americans injured each year from gun violence. That's the COVID pandemic year after year after year. And that's one of the reasons I really appreciate the chance to chat here. This is a public health problem that it is time for us to address.
So what types of surgeries do you do or are relevant and prevalent in your line of work when it comes down to gun violence?
It's the worst. I'm a parent. I have 3 children. It is some of the worst conversations that we have to enter as a physician. Often, again, I'm a pediatric trauma surgeon. So parents are rushing to the hospital. They don't know what happened. They just got a call that they needed to come in. They don't know if their child's alive, dead, how bad it is. And when we first show up in the trauma bay, we don't always know, depending on how much time and notification we've been able to have. Cohen's, we're the largest level 1 pediatric trauma center in all of New York State. So unfortunately, we have seen also a rise in the number of pediatric traumas that come in as a result of gun violence. And as far as your question in terms of surgeries, there's a full range. Unfortunately, the bullets don't really distinguish between different parts of our body. They just go through all of it, whatever it's in its way. So sometimes if you're lucky, if you want to use that word, it just catches a limb. It goes through a leg. It goes through an arm. It doesn't catch anything that's a major blood vessel or a nerve. Other times it goes right through the torso and it catches major structures in the chest or in the belly. And it's a rush to save that person's life. Every minute counts. And we've done a lot of work trying to help support community violence interruption before it gets to try to prevent these injuries before they happen. But once they're in with us, we activate our trauma response. We get whatever care we need as fast as we can to that child. And then all of our team that helps take care of the child afterwards in the intensive care unit, the nurses, it's got to be said, all the social workers in terms of the behavioral health aspect of this, really activating an entire children's hospital to wrap around the care that child. And then the family needs. This is devastating for the people who are not shot, but who will live with the consequences of this forever.
So tell us about what is Northwell Health Center for Gun Violence Protection. When did that start? And tell us all about what they're doing.
Yeah, it started with Mr. Dowling, our CEO, really making a call for action at a national level. He was seeing what was happening around the country and here in New York. And he put out a letter in the New York Times, call for action on to get this conversation into the healthcare lane, and for all of us, but really under his leadership, to say that we as a healthcare system have to be active, have to take a leading role in trying to address what we believe is a major public health problem. And really, that led to the creation of the Center for Gun Violence Prevention for Northwell. And one of the initial things that Mr. Dowling called us to do was to bring together at a national level all the different voices that are involved in this conversation under the umbrella of healthcare to think about how we prevent this problem and this scourge across our country. And so we initiated an annual gun violence prevention forum. And we now have had our third one of those in the sequence over the last 3 years since Mr. Dowling's initial call, and it's something we look forward to doing every year in that format to bring together agents of change and to really help to get that conversation going. But that is really only a starting point. That call for action. We got CEOs from across the country in different healthcare organizations to sign on to pledge to work on this problem locally at their own sites and to work on research, to work on learning best practices. And we built a national gun violence prevention learning collaborative for health systems and hospitals specifically That was not something that existed before. There was really no place for healthcare, the healthcare industry as a whole, to come together to share best practices, to lessons learned, to help give each other advice and encourage each other along this path. And then the last thing that really led for us to do was to really take a leadership in the research space. Chetan Sathya is the director of our center, and Chetan is really went out and has done a lot of great work in this space and got one of the first National Institutes of Health grants to study how do you implement this call to action in the hospital setting. How do you actually ask questions around gun violence? What's the best way to talk to folks about this? How do we support with science how we try to interrupt this cycle of violence, whichever one of the different categories we're talking about. And so that grant was a really big deal. For many years, the federal government was not funding gun violence research, and we are essentially in many ways flying blind when you think about other major problems that kill 40,000 Americans a year compared to heart disease or cancer or other important problems. But the amount of funding directed to this was really quite limited.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about local hospital systems and their efforts to prevent serious injuries involving gun violence. My guest today is Dr. Jose Prince, one of the leaders of the Northwell Health Center for Gun Violence Protection. Dr. Prince is the vice chair of surgery as well as the vice president and systems chief of pediatric surgery and acute care surgery at Northwell. He is also surgeon-in-chief at Cohen Children's Medical Center and a professor of surgery and pediatrics at Zucker Schools of Medicine at Hofstra-Northwell. You talked about different events that are put together to support this effort. What events are they specifically?
Well, we have the annual Gun Violence Prevention Forum, and that's open to folks. There's a web link. It's www.preventgunviolence.com for anyone who's interested in learning more about that specific venue. We created this National Gun Violence Prevention Learning Collaborative for health systems, as I just described a little bit. And we have now in this year, we'll be working with the National Academies of Sciences, Engineering, and Medicine, one of the foremost organizations in the world, to put together working groups to discuss this problem on a national and really an international scale, because let's also speak about the fact that gun violence doesn't just stop at our borders. And so all of these are out there. There are things that we've been very much actively working on and trying to promote avenues for conversations and to really bring in line the focus on prevention, harm reduction, and thinking about this as a public health problem. Just to give an example, there was a time when cars had no seatbelts, and that's an engineering thing. That's a political thing. You can't buy a car without a seatbelt now, as hard as you would try. And that was a public health approach. That was identifying something that was killing and destroying Americans once we built these great highways and these great big cars that could go so fast in the 1950s and 60s. And we've made a real impact when you look at that. And there was a time where smoking, I think about being a kid and being on planes and people smoking cigarettes next to me on the flight to visit my family in Miami. That's unthinkable now, that you would get on a plane and folks would light up cigarettes next to you. That's a huge change in culture in terms of using and thinking about problems from a public health point of view. This isn't about the Second Amendment. This isn't about trying to take away people's guns who lawfully and rightfully have them. This isn't about limiting hunting or anything else like that. This is about safe use and storage of weapons. And I think that's something we can all get behind. There's a lot of data to show that both individuals who are owners of guns and want to own them responsibly and individuals without weapons want to see them safely stored, safely used to try to avoid the senseless violence that can come from unprotected weapons.
So how do emergency rooms in Northwell systems screen patients for risk in firearm injury, particularly those who have mental health issues? When they arrive to your emergency rooms, what is the process of screening?
Yeah, so that's exactly the question that Dr. Sathya and Dr. Kapoor, who is working with him hand in hand. Dr. Kapoor has led our efforts on opioid and other substance abuse work across the system, and as a lot of mental health issues, substance abuse issues, a lot of this comes together in many different ways in our communities and in individuals. So our research project is looking at the beginning, 3 specific sites in the emergency department, the Cohen Children's Medical Center and 2 adult trauma centers that are part of Northwell's trauma system, and asking really just everybody about what weapons are available, are they safely stored, and trying to understand what's the best way to do that. And that's a new approach, and it's very similar to asking everybody about, when you go to a doctor, it's not surprising anymore for somebody to ask you if you smoke. It's not surprising for somebody to ask you if you use drugs or alcohol in your life. It's not judgmental. It's just understanding what's there and then understanding what information we can offer for people to make good choices in their life.
What are some of the harm reduction strategies that Northwell tries to implement, such as gun locks or gun drop boxes? Or is there anything like that Northwell is implementing?
Yeah, we are working a lot with a number of partner organizations. And so, this is where the police and others who have a lot of experience in terms of understanding how to safely handle weapons and what's the best way to work on gun locks, for example, and make them available to individuals. So we do partner. We do have programs set up for that. But even there, the questions from a research point of view is what's the right way to do that? How do you get that gun lock to the right person? How does it actually get used? There's really a lot of work to be done in this space to understand what are the most effective approaches to accomplish what we're talking about, which is safe use of the weapons. We have some common sense things that a gun should be locked in a safe place. It should not be loaded. The bullets and the ammunition should be stored in a different place. And when you think about, you mentioned behavioral health. There's a real sense the time and the intentionality of stress, just giving people time before they react. Again, you talk about a child and not finding a loaded weapon that's not secured. There's real common sense, practical things that folks can do to make a weapon more safe at home. It also has to be said there's a lot to do to educate doctors, physicians, and those of us in this space. Many folks are not owners of guns, have never fired a gun. They don't know what a gun lock is or how it works or what it looks like. They don't have this personal experience themselves. So we also have built a curriculum to teach medical students, other kinds of healthcare worker students, the residents, the physicians. How do you ask this question? When you ask about a gun lock, what does that mean? What do they look like? How do they work? How practical are they? What are the costs involved? There's quite a bit of work to be done in this space.
Another question, what has Northwell done regarding trying to educate and prevent gun deaths as a result of suicides? It's not just people shooting each other. Sometimes people shoot themselves, as you said, and those are people that doctors need to try to help in advance. Am I right?
Yeah, absolutely. And a lot of work has been done with our colleagues in behavioral health. And this is true for the pediatric space as well as the adult space. Obviously, anyone who has these worries at home should reach out for help and raise this issue. Different states across the country have different laws around how to protect someone who we're worried might be at risk for suicide acutely in terms of what access they have to a weapon. So becoming familiar with that as individuals. But then within the behavioral health space, I'll use an example from pediatrics. We've done a lot of work in a number of school districts now, including my own in Rockville Center on the South Shore of Long Island and Nassau County, setting up school-based, community-based behavioral health crisis centers, essentially, for kids and folks who are having acute issues and having a clear place to go, supported by the school districts. So there's really an opportunity here to build around that mental health, wellness, and that's, again, emphasizes the importance of healthcare organizations like Northwell to enter into that space. How do we create access for individuals when they're in those moments of strife? How do we then follow that up in a longitudinal way? How do we get those resources to families? So we are very much entering into that space, working on that in a number of different ways, trying to intervene. I also would add it's important to reach out to other parts of the community. So we're partnering with quite a number of faith-based organizations. There's law enforcement, which I mentioned, local firearm owner groups, and different community-based organizations that are out there doing this good work and trying to figure out, as a healthcare team that we live here. This is our home as well. And Northwell is an employer. We have 80,000 employees that live right here in the New York metro area. Having access for them and helping them build into that space.
You're listening to Your Family's Health on the voice of Nassau Community College 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about local hospital system and its efforts to prevent serious injuries involving gun violence. My guest today is Dr. Jose Prince, one of the leaders of gun violence. He is a leader at Northwell Health Center for Gun Violence Protection. Dr. Prince is the Vice President, Chair of Surgery, as well as the Vice President and Systems Chief of Pediatric Surgery and Acute Care Surgery at Northwell. He is also a surgeon and chief at Cohen Children's Medical Center and a professor of surgery and pediatrics at Zucker School of Medicine at Hofstra-Northwell. So, Dr. Jose, would you say that it's quite easy to get a gun these days? And would you ever advocate for someone to get a gun, particularly if they're coming or in a violent environment or violent community?
Unfortunately, it is quite easy if you really want to get a gun. In some ways, I say that unfortunately because some folks who shouldn't have access to guns are able to access them. And, that happens in a national way. It's not necessarily here based in New York, but when you think about our country and the ease to acquire guns and firearms in other states, those come into New York and into our communities from outside of here. And sometimes are legally purchased and then handed off in the background market of how weapons move across and trafficked across the country. Personally, I don't have a gun in my home. I don't advocate for it. There's a lot of data to show that the odds are actually much higher that the gun will be used and hurt someone in the home than it will be used in that incredibly unusual situation where someone breaks into your home or you have to defend yourself in a moment of life and death. And that has a lot to do with the categories we talked about, that of unintentional use of the arm by a child or someone who's unsupervised or inappropriate, or someone grabbing in a moment of anger or depression and using it on themselves. So, and also in other forms of interpersonal violence and abuse. So, I have my way of thinking about this is that I want to, how do we build a healthy and safe community for all of us? And arming myself at home isn't going to change that reality when I step out on the street, but speaking with you and speaking and engaging with all of our community and coming together around this to build a healthy community, that's really where the safety will come in. And at this point, there are more guns than people in the United States. So it's not realistic to think that somehow we live in a world without guns. But building a world and in a community where we all understand what the risks of those guns represent, how we can reduce those risks in terms of how they're stored, who has access to them, and how they're tracked or are available. The tracking part is concerning to a lot of folks in terms of Second Amendment rights, but at least that we know that folks who should be able to get one, that they register, they go through a process that seems fair and appropriate to have something that has so many implications to it. Just like I have to get a driver's license to drive a car, which is probably one of the most deadly things I do every day when I get in the car.
I know that your website states that Northwell advocates for the need for more behavioral health funding, treatment, and support, particularly without stigmatizing the mentally ill. So can you expand on that statement?
Yeah, I think that there's a real need to invest in mental health services, and that at the end, for someone who suffers from severe mental illness, to just point to the gun component is to look at the tip of the iceberg and not the larger problem that person is suffering through, and the risk that poses to us as a society, and what that structure looks like. This is something that we're seeing in so many different ways. It's not just gun violence, but other forms of violence, and really there's a tragic cycle there. The folks who suffer from mental health illness often are as a result of that homeless, often suffer from violence themselves. So how do we as a society tackle this problem and not lose sight of that? And so I think that That's an important part. And then how do you target different needs in different communities? So again, this isn't about the state or us as outsiders coming in as a big system and telling a local community what they need, but really working with the groups that are very active in this space and supporting them. They're very good at identifying. They know what the problems are. They know who the problems are. They have very clear ideas about what could be done to think about this problem and take it on. Working with them, partnering with them. And again, as the healthcare organization, trying to bridge some of the distrust that exists out there between different groups that are here. Sometimes there's a real distrust with law enforcement or other agencies and what the motivations might be. And yet the motivation for all of us is a safe and healthy community. So how do we as healthcare come into that space, not to stigmatize it and really just be focused on prevention and harm reduction? And I think that culture change, that growth, that's something that we want to spread out, not just here in the New York area, but then nationally, get collaboratives that can bring in best practices where we see partnerships that have worked with law enforcement, with community intervention violence groups across the country. Bring those models into New York or share what we've succeeded doing here in the New York area with others.
So I read that Northwell is creating a center that will be organizing an international gun violence prevention learning collaborative. I know that you spoke a little bit about that. Can you tell us more about that? And this particular center, can anyone walk in off the street, or what is it really for?
Yeah, the center is really in this modern world is it has a physical component, but it's mostly the people. And it's mostly online, and it's really out in the community. So working with the different folks that are out there in the community doing this good work and partnering with them, that's really where the center lives. The forums that we generate and everything that we're producing from that point of view lives online and is available to folks to access there, and is really open for anyone who would like to learn more, and in the future who would like to participate and join us in this.
So this is an online platform, and if so, what is the web address?
I would point folks to within the Northwell space. There's at www.northwell.edu, the Center-for-Gun-Violence-Prevention, and then, as I mentioned, the larger forum, which will point you there as well, which is the PreventGunViolence.com. Those are two web-based access points that will really then help folks get to learn more about what we're doing, learn more about the problem that's before us, and find opportunities to engage and join into the work that we're doing.
Well, this was very informative. Thank you for being here, Dr. Jose Prince, one of the leaders of Northwell Health Center for Gun Violence Protection. Dr. Prince is the Vice Chair of Surgery, as well as the Vice President and Systems Chief of Pediatric Surgery and Acute Care Surgery at Northwell. He's also a Surgeon-in-Chief at Cohen Children's Medical Center and a Professor of Surgery and Pediatric at Zucker School of Medicine at Hofstra-Northwell. Hope you stay safe and continue to stay healthy, and thank you so much for being our guest today.
Thank you, Dr. Jeanine. It's been my honor to participate.
This is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the Nursing Department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.